Good morning. Dr. Walker from denwalker.com, visiting Jamaica for the last couple of days. You can see behind me there. This morning I'll talk a little, however, about several medications that you should know about that have been associated with Alzheimer's dementia. Now, if you like what we're talking about, like what we're doing, give me a thumbs up, give me a like, and let me know that you like what we're doing, and so I can continue doing this kind of work. Anyway, getting into it. Number one, statins. Statins I've talked about before, several times before, what they do. They are supposed to decrease, and it does, decrease the LDL cholesterol by 20 or 30%. To what end? I don't know. You don't know. No one seems to know, but they're trying to decrease the LDL cholesterol. And again, cholesterol used much in the brain, right? Much in nerves, and in fact, all cells of the body require some degree of cholesterol, but we're decreasing them to some end, don't know to which end. However, in addition to decreasing LDL cholesterol, it is also associated with decreasing your CoQ10 levels. CoQ10 essentially is the gasoline to all the mitochondria in your body. So as the old saying goes, if you don't use it, you'll lose it. Losing it means that you end up having cognitive disorders associated with decreased energy to the mitochondria in those areas, causing some degree of Alzheimer's dementia. The other one we talk about, and I talk about this a lot as well, are PPIs, proton pump inhibitors. Proton pump inhibitors, they're supposed to decrease the symptoms of acid reflux disorders. Now, I've talked about, again, several of those other things that can actually decrease the burn or the symptoms you have from reflux, but you do not necessarily need a PPI, proton pump inhibitor, to decrease the burn per se. Now, the reason I'm against them is because it brings the pH of the gut from a 1.5 to somewhere like a 6. Now, at 6, you cannot extract the food, the minerals from your food, like your calcium, magnesium, to be utilized in your body where it needs to be, right? You can't do that with a pH of 6, and that's one problem that it has. The other one is that it decreases your production of B12. Now, B12, if there's anything else that you need in your body, you need B12. B12, again, supports your brain function, sleep, your sleep pattern, your peripheral nerves. Again, B12, one of the most important things for overall body functionality, brain function, sleep things. All of those things very important for B12. And if you have, if you use PPI chronically, some people would say as short as 3 months, your B12 level is likely diminished from that. And I've also said in the past, which you may want to do, especially if you're on PPIs for a long time, is just have your doctor double check your B12 levels to be certain that they're still adequate, because many doctors do not think about that, do not think about the disorders that can cause with PPIs, again, specifically in this case, B12 disorder, which in this setting is associated with cognitive disorder, brain disorder, Alzheimer's dementia, to name a few things. Now, there are other medications, for example, anticholinergics like Benadryl, sleep meds like Ambien Muscle Relaxants like Flexeril as well. There's a whole list of them, right? And the problem I see with many of them is that your doctors typically don't talk about them. So I just want to let you know now, Dr. Walker's not telling you to go and stop your statin or stop your proton pump inhibitor, right? That's a discussion between you and your doctor. Typically, like for PPI, there is a process in which you have to sort of curtail the use of those things for yourself long term. But I'm not trying to stop your PPI. Don't stop your statins. Talk with your doctor about them. And again, some people, and there's ones that I talked about before, that reported that people that were on statins, especially people that had low-level cognitive disorders already, once they put them on statins, the dysfunction got worse, right? And then when he stopped the statin, their brain activity, brain function improved significantly. Anyway, thanks for listening, Dr. Walker.